I'm washing my hands. Wash my hands. Hi, my name is Jennifer Acefano, and I'm here to do my nursing assessment for Nursing 650. And this is my patient. Hi, what's your name?
Hi, I'm Isabella.
Hi, Isabella. My name is Jennifer. I'm going to be doing your assessment today. How are you?
I'm good.
Good. Can you tell me why you're here today?
I've been sick with a cough.
Oh, with a cough for how long?
Maybe a week or 2 weeks.
A week to 2 weeks?
Yeah.
And how was the cough? Is it productive or is it dry? You coughing up sputum?
Yeah, it's pretty wet cough. I'm coughing up stuff.
Okay, coughing up any blood?
No.
Have you had a fever or any other symptoms with it?
No.
Okay, good. And can you tell me, do you have any allergies
No.
to any medications?
Not that I'm aware of.
Okay, do you take any medications?
No.
Okay, sounds good. Well, let's get started with the exam. Is it okay if I touch you?
Of course.
Okay, so I'm going to start by taking your pulse. So I'm just going to I'm going to move your chair a little bit closer to me. I'm going to feel your pulse first. Okay, so what I just did is for 30 seconds, I felt her pulse. Her pulse was 32 over those 30 seconds. I'm going to multiply that times 2 for a full minute. So her pulse was 64 beats per minute, which is normal. Normal is between 60 and 100. And then for the second 30 seconds, I looked at her respirations and I measured 9 respirations in 30 seconds. Multiply that times 2, and that's going to be 18 respirations per minute, which is normal. The normal is anywhere from 12 to 20. So her respirations and her heart rate are within normal limits. And Isabella, how old did you say you were?
I'm 18.
You're 18. Okay. So just looking at Isabella and her dress is appropriate for an 18-year-old. Her appearance, she's got a calm effect. She's smiling. She's cheerful. She's answering my questions appropriately. She's acting cooperatively. And so thus far everything's normal. So I'm just I'm just taking a brief overview of her skin. She's got a little bit of acne, which is typical for her age group. I'm looking at her arms, her skin, and her legs. I'm gonna have a look at her arms on both sides and her fingers. Her nails look appropriate. There's no clubbing, there's no abnormalities in her skin. I'm gonna pinch her nail beds, looking for a capillary refill. And her blood comes back to her nails in less than 3 seconds, which is normal, showing me that she's got good circulation in those extremities. So the next thing I'm going to do, Isabella, is I'm going to have a look at your head. Is it okay if I take a look at your head and scalp?
Yep.
Okay, so I'm just going to use, this is a Q-tip. I'm just going to have a look at your scalp. I'm looking for any abnormalities. I'm looking for any lesions, for any flaking. I'm looking for any bumps. Looking for any bugs, nits, those sort of things. So your scalp looks good. I don't see any abnormalities there. I don't see any nits. So we're going to move on, and the next thing I'm going to do is I'm going to have a look at your neck, and I'm going to palpate your lymph nodes. So I'm going to start with the lymph nodes in the back of your head. This is the occipital lymph node, so I'm going to palpate here. You just let me know if you have any pain when I press. And then the next set of lymph nodes are the post-auricle, behind the ears, and in front of the ears is the pre-auricle lymph nodes. And I'm coming down underneath her chin, under the mandible, and I'm feeling for the submandible, the tonsillar, and the submental underneath her chin. Then I'm going to go down and I'm going to feel the cervical lymph nodes in her neck, and in the back of her neck, the cervical posterior. And then along the supraclavicle, or along the clavicle, the supraclavicular clavicle lymph nodes. So what I'm feeling for is any sort of bump or lump that's a pea size or greater, and any pain or tenderness that she might have. Did you have any pain or tenderness?
No.
And I also didn't feel any abnormality, any lump or any tenderness or any masses there. So then I'm going to have a look at your neck. We're going to have a look at the range of motion of your neck. So I want you to first shrug your shoulders, and I'm going to push against you. Then you're going to turn your head to the side, kind of push with some force. So I just tested her cranial nerve 11. So that is all intact. The next thing I'm going to do is I'm going to have a look at the rotations of your neck. So I'm going to see if you can extend and flex your neck back and forth. So that should be 45 degrees, which it is. And then turn your head from side to side for a total of 40 degrees in each direction. And then I'm going to have you rotate your neck and then repeat or reverse the other way. So that should be a total rotation of 70 degrees. Any pain on that rotation? So that's within normal limits. Okay, so the next thing I'm going to do is I'm going to have a look at her eyes. So I'm going to first just have a look around your eyes, suborbital. I'm looking for any edema underneath and above, any swelling or edema in her eyelids, or any drooping ptosis in the eyelids. I'm making sure that her eyebrows are symmetrical as well as her eyes are symmetrical. I'm next going to have a look by pulling down underneath her eye so I can have a look at her conjunctiva. Her conjunctiva should be white with some vessels, but not overly red and not a plethora of vessels. I'm next going to have a look at her sclera on the sides of her eyes. So I'm looking for any discoloration that's not white, such as yellowing or graying, signifying some sort of disease, which she doesn't have. Everything's within normal limits. I'm also going to have a look at her cornea. Just looking, I can shine a tangential light on both sides. I'm looking at her cornea for any abnormalities, any spots, or anything that's not supposed to be there. So everything looks good so far. So the next thing we're going to do is going to test the different cranial nerves for vision. I'm going to move you a little bit closer to me for a second. So the first thing I'm going to do is shine this light into your eye. It might be a little bit uncomfortable. I'm going to dim the lights for this particular example. Then we'll turn the lights back on after it's done. So first thing I'm going to do is shine a light into your eye, into your left eye, and into your right eye. So what I'm looking for is her pupils are constricting, which they are. Her pupils are both round. They are symmetrical. They're both round. They're about 3 centimeters. And they are the same size in both eyes. So they're round. They're reactive to light, which they were. And what I'm going to do then is check her accommodation. So what I'm going to have you do is I'm going to have you with your eyes focus on the wall in the back. And when I tell you, you're going to focus on the pen light. Go ahead and focus on the pen light. So I'm looking for her eyes to constrict as she focuses on the pen light up close. Her eyes both constricted. She's not having any nystagmus or any stigmatism or strabismus that I'm aware of or that I can see. So her perla is intact. The next thing I'm going to do is test your peripheral vision. Oh, and what we just tested there, perla, those were the tests of cranial nerves 2 and 3. The next thing we're going to do is we're going to test your peripheral vision. So I'm going to have you cover the right eye with your right hand, and I'm going to do the same on my eye. And then I'm going to have you just point out how many fingers I'm holding up.
2.
How many fingers?
3.
How many fingers?
2.
How many fingers?
1.
Good. Do you have any blurring when you look at my face?
No.
Okay. So go ahead and change eyes. Cover up the other eye. Can you see my face?
Yes.
Is there any blurring?
No.
Okay. So same thing. How many fingers am I holding up?
2. 1. 3. 2. 3.
Okay, good. So her peripheral vision is intact. And the reason I covered my eyes is I need to make sure that my fingers are within my line of view as well as within her line of view. And at that time that she said 3, I also couldn't see my fingers, so I had to move them over so that I could see appropriately as well. So that's a test of cranial nerve 2, looking at the peripheral vision. Okay, the next thing that we're going to do is, let me think. Oh, I'm going to look at the 6 cardinal fields of gaze. So those are going to be testing your cranial nerves 3, 4, and 6. So I'm going to have this pen light. I'm not going to have you move your head. You're just going to move your eyes and follow the pen. So we kind of moved the pen and an H factor. Her eyes were able to follow the pen in all 6 directions. There was no nystagmus, there was no strabismus, and she was able to follow all 6 directions appropriately. So the 6 cardinal fields of gaze are also intact. Okay, so we've looked at the eyes. The next thing I'm going to do is the next part of the examination would normally be conducted in the dark. It's not as dark in here as it should be for me to conduct this exam, but for the purpose of the video, we're not going to put ourselves in complete darkness. But this is an ophthalmoscope, and what I'm going to do first is I'm going to have a look at the red reflex. So I'm going to turn the light on, and I'm going to set the dial to 0. And I'm going to find the red reflex first. And I'm going to be an arm's length away, and I'm going to have a look through the scope, and I'm looking for the red reflex. So I found the red reflex in the left eye, and I see the red reflex also in her left eye, and then also in the red eye. So finding the red reflex is important because that shows that we're using, first, the scope, the ophthalmoscope is being used correctly, and secondly, we're making sure if I can't find the red reflex, then I need to reevaluate and try again to make sure that I'm using this device appropriately. Or that could also signify that there's some sort of opacity in her cornea or in her retina, and that's something that's going to need to be investigated further. So we found the red reflex. The next part of the exam, I'm going to turn the light back on. Isabella, do you wear glasses?
Yes.
Okay, do you wear glasses for nearsighted or for nearsight or for farsight?
I'm nearsighted, so I use them to see far away.
Okay, so that's going to help me adjust the dial on my ophthalmoscope. I'm going to go into the red area for myopia because she's myopic. I also am myopic. Okay, so I'm gonna try this at 4. I might need to make some adjustments. So for this one, I'm gonna have to get a little bit closer to you. So I'm gonna pull your chair a little bit closer. Sorry to be right in your face. And I'm gonna be looking with the same eye. I'm gonna kind of come from the outside. So what I'm looking for, make some adjustments here. Okay, so I'm looking to find the red circle in her retina, and I'm looking for some blood vessels, so I can see some blood vessels, and I'm going to follow those blood vessels around until I find the optic in the fundus of her eye. I'm looking for the optic nerve, or for the optic disc. Okay, so I've located the optic disc after finding the vessels. Good. Now I'm going to do the other side. So that is intact. I was able to visualize that. I'm going to get you a little bit closer. Thanks. So I'm going to start from the outside and come around. Okay, so I'm visualizing some vessels in her eye, in her retina. And then as they move around, I can follow the vessels until I find the optic in the fundus of her eye. Okay, and there it is. I saw the optic. All right, good. So that seems to be intact. Okay, I'm going to turn the light back on. Thank you for that. The next thing we're going to have a look at is your ears. So I'm going to turn your chair so that I can have a look at, actually, first I'm going to look at the front of you. I'm going to look at your ears, making sure they're symmetrical and they're about the same height, which they are. So now I'm going to turn you to the side. I'm going to have a look at the exterior aspects of your ear. I'm looking for any lesions, redness, scaling, etc., which she does not have. Everything is intact. And I'm going to change my ophthalmoscope to be an otoscope so that I can analyze her ears. So turn the light on. So I'm looking at the exterior of her ear. Everything looks great. So now I'm going to look at the interior canal of your ear. I'm going to pull on the pinna to be able to access the internal canal. So I'm going to pull a little bit more. And I'm looking in the internal ear canal. I'm looking for any sort of abnormality, any redness or swelling. And I'm looking ultimately I'm looking to find the tympanic membrane. Oh, there it is. So the tympanic membrane that I'm now visualizing is a white pearlescent in the depth of her ear, and I'm looking to make sure that's intact. There's no holes, and it is. You do have some earwax there. I'm going to spin you around, same thing. I'm going to analyze the external surfaces of the ear. Everything looks good, no issues there. So again, I'm going to pull back on your pinna and insert the otoscope. And I'm looking at the internal ear canal. She does have a lot of earwax, but in the depth of her ear, I can visualize the tympanic membrane. It is also a pearly, grayish pearly white. It is intact, there are no holes. Great. I'm just going to test her hearing with the whisper test. So I'm just going to have you close your eyes, and you're just going to raise the hand for the ear that you hear a little bit of whisper next to. Okay, good. So her hearing is intact. The next thing I'm going to do is I'm going to analyze your neck because I forgot to do that. So I'm looking at your neck. I'm looking to make sure that it's symmetrical. I'm looking at the hyoid bone. I'm palpating the hyoid bone down to the thyroid bone, down to the cricoid process, and then I can feel the portion of her trachea. I'm looking for any deviation. I'm palpating to make sure it's midline and symmetrical. Any deviation can indicate she has a pneumothorax. There is no deviation that is apparent here. Everything looks completely midline and symmetrical. Sorry, can I have you swallow, please? Okay, no issues there. So the next thing I'm going to do is palpate the thyroid. So I'm going to turn you around for that and stand up. So I'm basically palpating down the trachea and the hyoid, thyroid, and cricoid cartilage to underneath. I'm going to displace the trachea a little bit so I can palpate better the thyroid. I might not even be able to, sorry if it's bothering you. Does it hurt? Is there tenderness?
No.
Does it tickle?
Yeah.
Sorry. So I'm going to try to do this lightly, but I'm palpating. You may not even be able to palpate the thyroid, especially if there's no edema and it's not abnormal. So I'm going to displace on the other side and try to palpate. And I don't feel any lumps or any abnormalities. I don't feel any bulging of the thyroid or anything on it. And I really can't really even palpate it. And I don't want to hurt her because she's uncomfortable with it. Okay, next thing I'm going to do is have a look into your nares. I'm going to turn this light back on. I'm going to have a look to make sure her nasal septum is symmetrical, which it appears to be. And then I'll also analyze the septum inside. But I'm going to have a look up her nasal passage. I'm looking at the turbinates, and they are intact. Her mucosa is moist and pink, as it should be. There's no mucus that I can see. So I'm going to look in the other nair. Again, I can visualize the turbinates. Her nasal mucosa is pink and moist. There's no rhinorrhea or any sort of mucus. Okay, so next I'm going to palpate her frontal sinuses. Do you have any pain or tenderness when I palpate here?
No.
And I also don't feel any swelling or any sort of abnormality. And then I'm going to palpate the maxillary sinuses. Do you have any pain?
No.
Okay, and that appears normal. So next thing I'm going to do is have a look in her mouth, and especially since she said she's had a cough. Have you had a sore throat with this?
Yes.
Okay. So I'm going to look in your mouth. Well, actually, before I do that, could you please smile for me and frown? Can you show me your teeth? So all of that's been symmetrical. Go ahead and stick your tongue out at me and move your tongue from side to side. Good. So there's no deviation of the tongue, which is normal. Her mouth, her smile, and her frown is symmetrical. So these are cranial nerves 9, 10, and 12 of the mouth. Okay, I'm going to have you open your mouth and say ah for me. I'm looking at the uvula. It elevates. It's symmetrical, or it's midline. I'm looking at her tonsils. She does have some swelling in her right tonsil on the right side. It's definitely enlarged, but not so on the left side. So she may need a referral to an ENT specialist for that swelling. Do you know if that's always swollen?
Yeah, it's always one.
It's always enlarged like that? That's your norm? Okay. I'm looking in her mouth. I'm looking at the soft palate and the hard palate. It's pink. It's intact. There are no lesions. There are no, there's no redness. Her gums and her gingiva are normal color. They're pinkish to a like whitish pinkish. Her tongue is pink. She has saliva. It's wet. It's clear. It's thin. I'm looking at her teeth. I don't see any cavities or any plaque or gingiva. Her teeth are clean with no debris. There's no odor. But I'm going to further look with the tongue depressor, just to move your tongue out of the way in the back of your throat. Okay, good. Everything looks good other than that swollen tonsil. Okay, so we got the mouth. Trying to think, make sure we get everything for the upper body. I think so. I think what I'm going to do now is I'm going to turn you to the side, and then I'm going to have you turn so your back is facing me, and you can stay seated in the chair. Okay, so I'm having a look at her back. I'm going to have a peek at your skin. Her skin doesn't have any lesions. I don't see any masses or any bulging in her back. I'm going to palpate down her spinal process. Do you have any pain or tenderness when I press here?
No.
Okay, so I don't feel any bulging from any discs or any abnormalities. I'm looking at the symmetry of her back. I'm looking to see if there's any lordosis, scoliosis, or kyphosis, which there is none. And the next thing I'm going to do is I'm going to find the 10th rib. And at that 10th rib, I'm going to put my hands across. And I'm going to have her take a deep breath, inhale out, and in and out, nice. And one more time. So I'm watching my hands as she takes that inspiration and expiration, that my hands both rise symmetrically on both sides and also go down symmetrically on both sides, which they are. So we've got symmetrical respirations or symmetrical expansion of her lungs. The next thing I'm going to do is test for fremitus, and I'm going to do that by putting my hands on her back, and I'm going to have her repeat 99.
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
So every time she says 99, I can feel the fremitus. It's a little bit of vibration. This is a normal result. We want to feel the vibration. If we're not feeling that vibration or that fremitus, that could be a sign of some abnormalities such as emphysema. She could have pulmonary edema or some fluid buildup in there. So I'm feeling the fremitus, so that's a normal result. Next thing I'm going to do is auscultate her lung sounds, and I'm going to do that using the stethoscope. I'm going to have you take a deep breath in and out. I'm going to check like a ladder along her back. Checking the upper lobes, the medial lobes, and the lower lobes. So I just checked, I auscultated posteriorly. Now I'm going to turn her and auscultate her anteriorly. So I'm going to do the same thing. I'm just going to have you take deep breaths. So what I'm listening for is clear breath sounds. Her lung sounds are clear, both in the anterior and posterior, anteriorly and posteriorly. I'm listening at the lung bases as well as the upper lobes and the middle lobes. Her lung sounds are clear. So if they were not clear, some of the things we could hear are diminished lung sounds that could signify that she's got pneumonia or some other form of lung issue. I could also hear some of the other abnormal sounds would be wheezing. That could signify she's having some airway issues. Crackles can signify she's got some fluid on the lungs, or rhonchi can signify that she's got some or stridor can signify she's got some airway issues going on in there. So her lung sounds are clear. So we're going to move to the next portion of the examination, which is going to be lying on the examination table. You're going to lie on your back, facing supine, with your head on that pillow. I'm going to move my tools out of your way. Sorry about that. So the first thing I'm going to do is I'm going to palpate the precordium. So I'm just going to place my hand over your heart. I'm palpating and feeling for any thrills, bruits, heaves, or lifts, which I don't feel. The next thing I'm going to palpate is the point of maximal impulse. This is the apical pulse. This is the strongest point where I can feel the strongest beating of her heart. Now, on her, I can feel it. I can feel the pulsations of her heart, or her heart rate, and I can match that up with the carotid artery. They should match up, which they do. They should be pulsing at the same time. It's not always possible to palpate the apical pulse on all patients, especially if there's large breasts involved, or pendulum breast, or if there's more adipose tissue, it might be more difficult, or you might not be able to do that. So the second thing I'm going to do is I'm now going to auscultate her heart sounds using my stethoscope once again. So I'm going to start at the second intercostal space, right mid-clavicle area, and I'm going to palpate the aortic valve. I'm listening for S1 and S2 sounds. I'm then going to move over. I'm going to stay at the second intercostal space, but I'm now moving over to the left mid-clavicle space, and I'm going to palpate the pulmonic valve. I can hear S1 and S2. So the next spot is to go to the third intercostal space, left mid-clavicle area, and I'm going to palpate the second pulmonic valve, or Erb's point. I can auscultate S1 and S2. Then I'm going to move to the fourth intercostal space, also in the left mid-clavicle area, fourth intercostal space. I'm going to auscultate the tricuspid valve. I'm listening for S1 and S2. And then I'm going to move to the fifth intercostal space, mid-clavicle on the left side, and I'm going to auscultate the mitral valve, listening for S1 and S2. So I was able to auscultate S1 and S2 in all 5 points. I'm not hearing any S3 or S4s, which would be abnormal. I don't hear any murmurs, thrills, or bruits, which also would be abnormal. The next thing I'm going to do is I'm going to analyze or inspect her jugular vein and look for any jugular vein distension. So, Isabel, I'm going to have you just turn your head away from me to your left, and I'm looking at the jugular. I'm going to straighten your head a little bit. I'm looking for the jugular vein. It's not always going to be visible, especially on her where she's not having any distension. She doesn't have any heart failure or any backup of fluids in her body. So she is kind of hard to actually visualize. We don't actually palpate the jugular vein because we don't want to occlude that vessel and the return of the blood back to her heart. So I'm just going to inspect that area. I'm looking for distension, which I don't see. And then I could also measure the distension if she were to have it. And I would do that by, keep your head turned to the side, please. I'm going to line a ruler on the mid-axillary area, and then I would use a ruler using my centimeter side to measure that distension. I mean, for hers would be about less than 1. Normal is anything less than 9 centimeters, so she's normal. She does not have any jugular vein distension. Next thing I'm going to have you do is just lift up your shirt so I can visualize your abdomen. I'm looking at her abdomen. Do you have any abdominal pain or any tenderness there?
No.
So I'm just inspecting her abdomen. I'm looking for any pulsations, for any lumps, for any masses, anything that I can visualize. There's nothing abnormal that I see. The next thing I'm going to do is auscultate the 4 quadrants of her abdomen using, again, my stethoscope. I'm going to start with the right upper quadrant. I'm listening for any normal abdominal sounds, so bubbling, air, movements within the intestines. I should be able to auscultate normal sounds or present bowel sounds in all 4 quadrants, which I have been able to. If she had an ileus or if she had some sort of obstructional blockage, I might not be able to auscultate sounds in all 4 quadrants. So that is absolutely normal what I've just auscultated, and her bowel sounds are all present. They're not hyperactive and they're not hypoactive, so they're all normal active. Next thing I'm going to do is palpate the 4 quadrants of her abdomen. She said she doesn't have any tenderness. If she did, I would palpate that area last so as not to hurt her. So I'm just going to palpate her abdomen, moving around from quadrant to quadrant. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Just a little ticklish, huh?
Yep.
Pain or tenderness?
No.
Okay, so I'm feeling for any masses, any abnormalities, hernias. I did not palpate anything abnormal. So the third thing I'm going to do is now percuss the 4 quadrants of her abdomen, listening for either a tympanic or a dull sound. If it's tympanic, that's going to signify that there's air underneath there, or air-filled viscera. If it's a dull sound, that's going to signify that there's a solid organ underneath there. So I'm going to put my hands. You're tensing up your stomach. Does it hurt?
No.
So you've got more of a tympanic here. It's a little bit duller. Okay. So everything is as it should be. So next thing, you can put your shirt back down. Thank you so much. Next thing I'm going to do is move down to her legs. So I'm looking at the muscular structure of her legs. I'm looking at her joints. I'm going to take your socks off if that's okay, so I can have a look at your feet. I'm looking at her muscle mass, so she does have appropriate muscle mass. There's no atrophy of the muscle. I'm looking at her joints for any redness and swelling in both the knees and the ankle joints, and the joints of her toes, which I don't see. The next thing I'm going to do is I'm going to test her range of motion in her knees. Do you have any pain when I touch your knee?
No.
I don't feel any swelling. I'm going to take her leg and I'm going to bend her joint. I'm going to use McMurphy's and I'm going to feel her knee. I'm looking for any cracking, popping, or shifting of her knee when I bend it. Any pain or tenderness when I do this?
No.
And I don't feel any popping or any changes in the meniscus in her knee. Do the same on the left leg. Okay, so appropriate range of motion of her knees. Then I'm going to move down her legs. I'm looking for any edema over the tibia. I don't see any edema in her legs. Looking for edema in her feet, which I also don't see. And I'm going to move down to the edge of the bed so that I can palpate her dorsalis pedis pulses in her feet. So I'm able to palpate them. They should be equal on both feet, which they are. And then I'm next going to palpate the posterior tibial pulses. These ones sometimes are harder to palpate. Sorry, I'm going to have to put a little bit more pressure on you. Okay, here they are. They also should be equal, signifying she's got blood flow going to both lower extremities. I'm next going to pinch the toes of your feet. I'm looking for the capillary refill in your toes. It is less than 3 seconds, which is normal. So she is getting appropriate blood flow to her extremities. While you're also lying there in the bed, I'm going to test your reflexes. And I'll start with the plantar reflex and the rest we'll do sitting in the chair. But what I'm going to do with my reflex hammer is I'm just going to kind of scratch up there. You should see some pronation of her toes, some flexion of her toes on both sides, which is a normal reflex, the plantar reflex. If her toes were to splay out like this, that's called the Babinski's reflex. That should only be seen in an infant or a person who's having any sort of cerebral defects. Excuse me. So that is normal. So next, while you're lying there, I'm going to test your sensations And what I'm going to be doing in your upper and lower extremities, I'm going to test your sensation to dull and sharp. So I'm going to use this pencil for this. I'm going to touch you either with the sharp side or the dull side. You're going to lay your hands at your side, and you're going to tell me if you feel sharp or dull. But I'm going to have you close your eyes.
Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp.
Good. And then lower extremities.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Okay, good. So her sensations are intact, uppers and lowers. One of the things I was also noticing too, as she walked from the chair into the bed, climbed into the bed, I was looking at her motor functions. I'm looking to make sure she doesn't have any coordination issues or any motor deficits. If she does, I would have to do some further tests or assessments on her. But so far, I haven't seen anything that warrants any sort of further testing. So the next portion of the test is I'm going to test your deep tendon reflexes. What that's going to do is that's a test for your upper and your lower neuron activity. If they are hyper reactive or hyper-reflexive, I should say, that's going to be a sign of having upper neuron defects. And if you have hypo or low hyperactivity, reflexivity, that could be a sign that you have lower neuron deficits. So that's what we're going to test next, and I'm going to have you come back to the chair for that. And for this portion of the exam, I'm going to use my reflex hammer. This is not the top of the line, so we're going to try our best with this one. I'm going to test a bunch of different deep tendon reflexes, starting from your upper body to your lower body. These are going to signify whether you have the higher up the reflexes are, that you're coming from your cervical spine, and then lowers the lumbar. So we're going to start first with your bicep. So I'm going to have you first make a muscle so I can see your bicep muscle. So I'm going to palpate with my finger the tendon of your bicep, and I'm going to have you relax your arm. Now this one sometimes is difficult to do because I'm going to hit my own finger and it hurts. But we should have some constriction of the bicep, which is going to have a flexion of the elbow. So she did have that reflex. Excuse me, my mouth is dry. So next is going to be the tricep reflex, or deep tendon reflex. So I'm going to palpate the tendon of her tricep in the back of her arm. And I'm going to use this side of the hammer. You could use both sides, but sometimes this one has more surface area to hit. So we're going to have constriction of the tricep muscle, and that's going to have a little bit of extension of the elbow. So we did see that. So the next is the brachioradialis. So the brachioradialis, the reflex is going to give us a slight pronation of the fingers of their hand, and sometimes even of the elbow. Okay, so we saw a little bit of pronation of the fingers, which is a normal deep tendon reflex. Next, we're going to move down to the legs, and we're going to look at the patella or patellar reflex. So I'm going to put my hand underneath to kind of hold you up here. Ideally, your legs should be dangling off the bed, and I'm going to hit your patella, and she should have a little bit of flex of the knee for this one. And then the last one is going to be the Achilles tendon. That's in the back of your heel. So I'm going to kind of hold your foot up. I'm going to hit the back of your Achilles tendon. Okay, you have a little bit of reflex of your foot and your ankle. Good. So that's so far that's all normal. So it doesn't. I'm not seeing that she has any sort of defect of her neurons. So the next thing we're going to test, the very final thing, is to test your coordination, balance, and your coordination, balance, and some of your cerebral functions. Okay, with some simple tests. So I'm going to start by testing first your rapid alternating movements, and I'm just going to have you rest your hands on your thighs here and just go back and forth. And go faster. Okay, good. So she's able to do that, so that's a sign that she's not having any problems with her rapid alternating movements. And then I'm going to just have you tap your toes alternating. Okay, so she's able to do that as well. So uppers and lowers. The next I'm going to have you test rapid alternating movements. And I'm going to have you do that by, on your fingers, you're going to touch your thumb to your fingers. Keep going back and forth and try to speed that up. So she's able to do the rapid repeating movements. So the next is a test of point-to-point movements, and I'm going to have you do that by keeping your arms outstretched. You're going to close your eyes, and you're going to touch your nose with your finger, with your pointer finger. Alternate and faster, faster. So she's able to touch her nose. Another way she can test that too is I could have her touch her nose and then touch my finger, which she's able to do. And then the lower extremity test would be then to touch your heel to shin. So you're going to take your heel and run it down your shin. So she's able to do that. So she's past the point-to-point movement. The next thing I'm going to do is I'm going to analyze your gait. So I'm going to have you get up out of this chair and you're going to walk to the door and back to the chair. Okay, good. So she has an appropriate gait. There's no gait issues. There's no ataxia or dystaxia. So now I'm going to have you do that again, but this time I'm going to have you walk heel to toe to the door. And back again. Well, it's a little bit more harder, but she was able to maintain her balance for the most part without any issues. Now I'm going to have you stand up where you are right now and hands at your side. I'm just going to have you stand still. This is the Rongberg test of balance, so I'm testing her balance. Can you close your eyes while you're doing that? So she can close her eyes and maintain her balance, so her balance is intact. Now can you stand on an alternating foot? Again? Can you do it with your eyes closed? Okay, so her balance is intact. And then stand there with your eyes at your arms at your side. Give her a little push. She was able to maintain her balance, so her balance is intact and her coordination is intact. Okay, you may take a seat. At this point, our examination is over, so I'd like to thank you for your time. Everything looks completely normal on this examination. The only thing I noticed is that tonsil is a bit inflamed and swollen, so we're going to have to analyze that a little bit further. And we'll adjust your cough with, currently I didn't hear you cough at all, so that's really good. So that might be resolving, but we might need to refer you to a specialist for that tonsil.
All right.
Well, thank you so much. Have a great day.
You too.